Welcome to Doing, Being, Thinking, dialectical behavior therapy skills for making a life worth living. I'm your host, Eric Nykamp, a therapist and clinical director at the Grand Rapids campus of Adolescent and Family Behavioral Health Services, a mental health practice with campuses throughout the great state of Michigan. Hello, everyone. Welcome to Doing, Being, Thinking, a podcast exploring the what, when, and how of using dialectical behavior therapy skills for making a life worth living. My name's Eric. I'm a DBT therapist and one of the clinical directors at Adolescent and Family Behavioral Health Services. In today's episode, we're going to be talking about pros and cons, which is part of the distress tolerance set of DBT skills. And joining me today is my friend Nate Knapp. He's an LLPC. He's another one of the therapists here at AFBHS. How are you doing today, Nate?
I'm doing good, Eric. Nice to be here. Looking forward to our chat today.
Yeah, me too. These are usually pretty fun. Well, let's get to it. Let's talk about pros and cons. What would you say, Nate? What is this skill?
So, pros and cons are part of our distress tolerance family of skills. So, when I look at our 4 modules, we have emotion regulation, mindfulness, interpersonal effectiveness. And so distress tolerance is unique in that these skills are kind of designed and geared for when emotions get really intense. And so I kind of try to get people to picture on a 0 to 10 scale. Say we go north of a 6, start heading towards a 7, we're going to probably access distress tolerance.
I love that you describe this the same way that I do. Kind of like imagining that emotional thermometer getting somewhere over that halfway point. And you're like, okay, we're heading into distress. Yeah.
And it helps you kind of start to, in its name, kind of tolerate things in a more non-judgmental way, try to kind of get a handle of like what your environment is around you, get an understanding of your emotional state, get an understanding of your thoughts, but also not really trying to stop them.
Yeah.
You're just kind of wanting to be aware, like, okay, this is kind of what's going on. This is what I'm feeling. This is what I'm experiencing. And then it's pros and cons of, okay, now what do I do?
Yeah, absolutely. When might a person want to use this skill? Like, can you think of any common situations or even stories of where you've heard people using this skill?
Oh, sure. I've heard it as simple as trying to make maybe a decision in the store as to like what to buy between, 2 different brands of like maybe the same item, where maybe somebody's maybe one's on sale, maybe I like one more, maybe this one's a bigger size or cheaper. We kind of weigh those options out. So it can be as simple as that. But it can be things of maybe there's a conflict with your partner or significant other where, emotions are starting to intensify, and that urge to maybe want to say something out of emotion mind, and maybe realizing, should I say that? Should I not say that? Will it escalate the situation or won't it? And then also, I think it can reach a level of intensity of using it when maybe we're starting to feel unsafe. Maybe starting to maybe think about hurting ourselves, something like that. So it's a wide range of when we can use it. And I also think as that intensifies, you may find doing that pros and cons might not be something you're doing by yourself.
Oh, I love that. When we are really genuinely torn inside about like, I'm not really sure which thing I should do here, this is a really great skill to use. I don't know about you. Like for me, when I am in that moment, sometimes what I notice is my body feels really alarmed, but it feels like my brain is starting to shut down.
Okay.
And so like to actually have a way of thinking about what could I do here?
Right.
Instead of going into shutdown, I think that can be really helpful, especially if you're kind of making the assumption that I'm kind of damned if I do and damned if I don't.
Yeah. Especially situations like that where it's like, well, which one's kind of the best path forward?
Yep.
I think it also makes me think of some of our other skills, such as like ABC Please, where we talk about our short-term and long-term goals, and pros and
Yeah.
cons can help with that as well to kind of keep you in mind, like, okay, if I do something right now, how is that going to impact me down the road?
Yeah, that's right. I think sometimes I'm trying to think of like when folks come into treatment early and they can identify things in their own lives. These are things that I say or do that really cause me to feel regret. And I keep doing it. And it makes me feel stuck and maybe even a little bit scared that I'm never going to change or that I won't ever figure out how I'm going to stop doing these things that are either damaging to my body or damaging to my relationships. Or maybe, things like my job or career, but it's usually
Sure.
relationships and body. And if the thing that you do, this damaging thing, does give you a short-term benefit, like, oh, I feel this immediate sense of relief,
Mhm.
or I feel justified or vindicated, you know, that can be hard to say, I'm not going to do this thing that gives me this short-term reward. And instead, I'm going to do this thing that really moves me closer to my long-term goals.
Mhm.
Um,
Absolutely.
I had someone talk to me this week about they were getting bullied. And the thing that they wanted to do was always fight back when they would get bullied because they kept having this thought like, I don't want to take this anymore. I'm not going to let them win. But their goal was, I want to learn how to manage my emotions in a way that I feel proud of myself.
I like that.
And the thing that they wanted to do in those moments was getting in the way of their goal of feeling proud of themselves, feeling like they were behaving in a way that was much more in keeping with their values, which was like, I'm kind of a peaceful person. I want people to feel like they can come close to me. And if they always think that I'm aggressive, they kind of keep their distance.
Absolutely. Yeah. And it can kind of be a gut check for somebody to kind of go, well, if I respond this way, what will happen? And
Mm-hmm.
then kind of like you just said, and exploring that with clients and saying, well, what if you didn't? Or
Mm-hmm.
what if you did this instead? Or if you did do that, what might happen as a result of that?
I know for myself, I've had moments like recently. I had one of my kids move home.
Okay.
And when they came home, they brought 3 weeks of laundry with them and I get why you do that. I mean, I totally understand it. Like you are going through something that takes a lot of energy and focus and you put off what you can put off. But then also there was like bags and bags of laundry all over our house, which kind of upset my desire for visual peace and cleanliness in the house.
Sure. Sure.
And I noticed when I would walk into the house at the end of working for the day, the first urge that I have is like, I kind of want to yell at somebody, like, come on, like, why does the living room have to look like this? But my long term goal is I really want my kids to feel like they can come home anytime they need to and be loved.
Yep.
And also, kind of then, when do I say something? Do I send a text? Do I yell? How do I handle my emotions that I'm having about laundry being all over the house, literally all over the house? Or do I do this other thing, which is maybe I can keep some of that to myself and tell myself things like it's not going to last forever. And you can hear the washing machine running. And that means they're working on it, even though it's going to take a long, long time.
Yeah.
How do you walk yourself through, in some ways, not doing the thing that's popping into your mind?
Yeah. It's hard sometimes when that urge tells you, to yell, to say something, to express or vent that frustration. As I hear you say that, it makes me think of my own situation with my partner, where her and I, it's our kitchen, where I'm the main cleaner of our kitchen, and a lot of times I'll come back in from somewhere and just see dishes or something anywhere from something she's made, and so I've had to learn, like, yes, there's maybe a certain way I want it to look, but at the same time, I also know, okay, if I say it right now when I'm really emotional or really stressed, it's probably not going to go very well. It's probably going to turn into a shouting match. It's probably going to turn into a lot of back and forth. And so I have to remind myself of, okay, the problem, emotional part is mine. But I kind of ask myself in the long term, short term pros and cons is my problem is how do I communicate this in a way that won't result in that? And so, I've realized like sometimes it's managing those emotions. It's kind of weighing out the pros and cons of if, I might want to say something, but do I say it now? What are the pros and cons of that versus maybe I say it later when I've been able to kind of reduce some of that emotional intensity and what I really want to say will be able to come out in a way that'll be better received.
100%. Yeah, that is the thing. Yeah, these are great examples of like when you would want to use a skill like pros and cons, which is a very thoughtful kind of skill. So let's go through how you would actually use this skill. Like, what are the steps?
So, yeah, I mean, and so this is where I really go back to my first point where you want to really know where your emotional intensity is when you're going through those steps. Because depending on where you're at, it's going to be a much different path for you. So when I kind of think of people listening to this, I would say, imagine kind of yourself where you're at, what you might need as I kind of walk through this. So one of the things is you want to describe that crisis behavior to somebody, to yourself, to whoever. We want to know what it is that's going on. Give us a picture, give yourself a picture with some details. When I'm in session with people and they have a hard time articulating, I like to kind of tell them, explain it to me through your five senses. And then we want to kind of we want to examine some of the advantages of disadvantages to maybe like acting on that urge or not acting on that urge. We want to consider any short-term or long-term consequences along the way. Examples might be some people where they might, let's say, have a fight with somebody or an argument with somebody and they turn to substance use or a substance in the moment. Well, there might be that substance that gets them that relief temporarily, but that following morning, they might be hungover. That might impact their job. So we want to kind of think through of like what might happen through that short-term or long-term choice we make. You want to consider your pros and cons for each of your urges. So if you're feeling multiple urges, we want to kind of sit down and go through each of those urges separately and just kind of what's the pros and cons to that urge? Because we're going to treat those very differently because they're going to feel very differently.
They will.
Like with a lot of our skills, we want rehearse pros and cons, repetition, repetition, repetition. The way we get better with the skills is by using them. So I tell them, I don't expect perfection. They shouldn't expect perfection, but we're going to get good at this simply by just using it over and over. You want to review pros and cons if an urge strikes. So let's say we've made this list beforehand. Say we created this and then the urge comes back, but let's say you're in a state where you're just too emotional to put those urges to paper. Well, then we can just pull those urges out and maybe go over them, have a chance to review them, have something accessible to them. So if they're creating these lists, definitely we want them to hold on to them. And then kind of interestingly enough, sometimes with that urge, if it's enough and we're kind of mindful enough, we're going to kind of say no. We're going to kind of try our best to resist it in the best way we can.
One of the things that I really appreciate about this skill, well, it's written. I don't know about you, but do you ever find that when you're writing something down, like even just the process of writing kind of slows our roll down just a little bit?
Absolutely. Journaling comes to mind with this, where people feeling very emotional, it's like, get that to paper. Let's kind of just take a few minutes, write it down. And by the time they come back or you're talking to them again, they might still be in that emotional state, but it's typically going to be lower.
Yeah. That's what I've found too, watching people do this skill in real time, is that there is a bit of de-escalation that will just happen just by the act of writing out what are the advantages and disadvantages of doing this thing I'm kind of thinking I might do or I might be likely to do.
Hmm. Absolutely.
The other thing that I think is interesting is that it's kind of validating. Like even choices where I'll hear people say things like, "I know this is the wrong way to handle it, but," and then they'll tell me a whole bunch of justifications for why they want to do it. I think to be able to say like, well, what are the advantages and disadvantages of acting on your crisis urges or not acting on them? Like when you're talking about like, well, there is some advantage. There is a function
Hmm.
that the behavior, even if the behavior saying I don't want to engage in this behavior, but it does have a reason for being there. We're not acting in ways that make no sense at all. It actually has a function. Like I want to feel like I'm not just taking abuse.
Right.
I want to feel vindicated. I want to feel like I stood up for myself. Or things like I want to feel relief. I want to feel relief from my physical pain or my emotional pain, or I want to forget for a minute. Like these are all very understandable desires that we have. And yet, to recognize that here's this thing that I know gets me this short term result, but I'm trying to get that short term result met in a way that also doesn't give me a longer term consequence.
Right. Yeah. And I think that's a really good way when following up with clients, walking through like what are we doing in the short term, listening to those choices. What are they doing? And like we do here without judgment,
Mm-hmm.
we're going to then go, okay, how does that then impact your long term goal?
So I had someone once. Basically, had they used ibuprofen to manage pain, and at a certain point, they found out that they had kidney disease. That now ibuprofen is not recommended because of their kidney disease. Right. So they had this way that was like a very functional way that most people use to manage pain.
Right.
But now they need to figure out a different way to manage the same problem. Because while it might work, it might also bring their life to an end a lot sooner.
Hmm.
And they didn't like that consequence, right? So they need to figure out like, well, what are these other things that I can do to manage pain that maybe they aren't as immediately effective as ibuprofen, but they are somewhat effective and they do eventually help me get to my goal of pain management or living the life that I want to live, even if it's not as rapid. And so sometimes it's like that choice to pick something that's slower but still effective.
Yeah. No, that's a great illustration of that kind of the instant gratification versus kind of like that long term, almost play the long game, if you will.
Yeah. I've had people do that with their relationships too, where they feel like they get what they want from the person they're talking to if they are really intense or really loud or really I don't want to say dramatic necessarily, but like to emphasize their words in ways that kind of are startling to their partner or to their friends. And they found out that like while they got what they wanted, it also was the kind of thing where people didn't want to really be around them so much and would start to back off, which would trigger some feelings of maybe I'm going to be left behind or that I'll be abandoned or that people won't want to be with me. And it was like, how do I get my needs met or how do I get to be taken seriously in ways that still draw people closer to me?
Yeah. Yeah. And it makes me think too for a person where, and I think of like conflict resolution when we're
Yeah,
dynamic with somebody talking, trying to, this is almost that conflict resolution, but it's kind of by yourself where
it is.
you're kind of weighing it out, like what went well, what didn't go well, if I do this. And yeah, it's hard when, especially when maybe we're feeling unsafe.
Hmm. Very much so.
And Obviously, if we know those people are going to hurt themselves, we also know they're going to lean into those behaviors more than maybe the skills we would like them to work on. And so, a lot of, and I'm sure you've probably worked on this. I know I have, is working through the pros and cons of not hurting ourselves.
Yep.
And kind of like you said, moving towards those behaviors of, I want to be able to manage my emotions effectively. I want to be able to communicate to people when I'm feeling something. And I don't want to hurt myself instead when I get to that level of emotion.
Yep. Not damaging our bodies and our relationships.
Yeah.
That's a really important thing. Like, how do we disagree in a way that we still communicate that we love? How do we get our needs met? How do we relieve our pain without hurting ourselves in other ways? These are really, really important questions to think through.
Absolutely. And, doing pros and cons, kind of to go back to how we use that, it really kind of shows in some of the examples we're talking about is just the level of emotionality is going to really impact those situations. So if we're, let's say, more in a self-harm intensity, that's where maybe we have somebody there alongside us, walking through those with us, kind of asking us questions, or is going over a previous list that they've made to kind of go, hey, you remember, this is what you said would happen if you acted on one of your urges. And so I think one of the more important things, at least for myself when doing this skill, is kind of helping people understand, like, before even launching into the skill, where are you at 0 to 10 on your emotional intensity?
That's right.
The higher it goes, the harder it's going to be to access those thoughts.
Well, you're kind of actually getting at this question I wanted to ask, is like, what might get in the way of using this skill? I mean, is that one of the big ones that you see?
Intense emotions, emotional dysregulation. That's what I kind of hear about in session as sort of like, hey, this is what happened afterwards or in the moment. So I do hear intense emotions a lot. With newer people, it's just maybe a lack of familiarity. It's a newer skill. They're not really sure. Sometimes when they create this pros and cons of, like, I can create it, but then it's, what do I do with it?
Mm-hmm.
And so that's where some of that repetition, practice thing is over and over, we really work on. And again, the urges to hurt ourselves. I think that's one that can really get in the way too, when we're not feeling safe and we want to hurt ourselves. We want this skill to be part of that repertoire, but we're also going to really understand if you might not be able to access it depending on how severe those thoughts and urges are. And that's where we're going to probably walk through a safety plan with you. We're going to kind of make sure you have supports nearby. Sometimes part of that pros and cons is pros and cons of hurting yourself, pros and cons of reaching out to somebody.
That's right.
So we explore each of these things. But it's our level of maybe role in it or facilitating it will vary depending on their intensity. Mm-hmm. Our goal is, we want them to do it on their own, but we also understand, like anyone else, is, okay, it looks like they need some help with this.
Yeah. I love using, I always call it the big book. We're not in AA. It's the DBT skills training handouts and worksheets.
Yeah.
And they have these homework pages for the pros and cons skill, where they have these little pros and cons grids that you can fill out.
Yeah.
I've had people write out their pros and cons, like early treatment for some of their urges, and sort of almost like a crisis management plan.
Mm-hmm. Yeah.
But then sometimes they'll come back to it like 8 months later.
I love that.
And they're like, oh my gosh, look how much I've grown. Or I'm not as tempted to do the opposite thing anymore.
That might be one of my favorite things to do with clients, is with pros and cons, through those lists, through our diary cards, is going 6 months in and then looking back at some of that stuff and going, especially when we feel like there's a plateau, or they come in a day feeling like they're just not being skillful, and we can kind of go, well, let's take a look.
Yeah. Well, now we're doing checking the facts, but that's for another day.
Yeah. We can pull that pros and cons list, like you said, and we can kind of say, okay, these were what those were before.
Yeah.
Do you feel like those are still things that are problematic for you? Do you feel like you're managing them better? And it is interesting to see those things evolve over time, where they become less problematic or they feel like I have more control over that.
There's another thing that I see sometimes that gets in the way for people. Well, two things. One of them is when we talked about like, am I too emotionally escalated? Another one is like, am I too intoxicated?
Oh yeah, that's one too.
I mean, I don't want to like hit on it too much, but there's even phrases that we use to describe attempts at coping while people are under the influence. Do we say or do things when we have substances in our bodies that maybe we wouldn't have done or said had we not? And so kind of like being clear-minded.
Mm-hmm. Yeah.
Same thing with like, are you too tired? Are you worn down in some way that, if you let the substance come out of your body, or if you had a little bit more sleep, or if you got something to eat, maybe that would take the intensity down just a bit. But the other thing is when we get a case of the I don't want tos. And I think it's important to kind of recognize like when we are being stubborn or when we're being willful. And it's not a lack of knowing that is the problem. It's a lack of desire. And just say like, I don't feel like it. Yeah. Like I know what I could do, but I don't feel like it.
And that kind of, when I hear that and I'm hearing kind of like it makes me think of another part of our book of the 4 solutions.
Yeah, that's right. That's what we're getting at here.
And when I think of staying miserable, which, hey, you can stay miserable. That is your choice. However, I can't really be much help to you if you're choosing to do that.
Mm-hmm. That's right.
But the other part I hear coming up here is like when we're trying to solve the problem here. And I know you've mentioned this before, and I've taken notes is, needing time, knowledge, resources, and influence to effectively solve a problem. As you mentioned, if we're fatigued, if we're under a substance, then we're probably not going to be able to solve that problem very effectively.
Yeah, that's right. Yeah, that's right. Well, as we close here, how would you say that pros and cons helps us make a life worth living? I mean, how have you seen it?
So I think of some things for myself with this. One, conflict resolution.
Yeah.
There's times when maybe there's something I'm trying to communicate, but I also know emotion where I'm at. And so I have to kind of weigh out how to say it, when to say it. If I say it this way, what's going to be the result of that? With clients, I think it's, getting an understanding of improving on not acting on urges, thoughts, and emotions. We want them to, have that life worth living where we're not hurting ourselves, where we're aware of those thoughts and those emotions, but we're also able to manage them and control them. I think of improved communication as something that's, at least in my experience, been very helpful, because sometimes it just helps map out maybe what you want to say or how to say it or what not to say. Mm-hmm. And then I think it also helps to, at the end of the day, really think things through.
Yeah.
It helps us consider our long-term and short-term impact of any of those decisions we make. And it helps you kind of weigh it out if, should you say this in the short term, or do you look at it and go, I'm going to say it maybe this way or hold off on this part because my long-term goal says maybe preserve the relationship.
Mm-hmm. Yeah. Yeah. I think you covered that. That was really good. I really enjoyed this conversation.
Yeah.
So for all our listeners, we hope that this episode helps you understand a bit more about pros and cons. While it can take a lifetime to master any of these skills, with practice, it'll get progressively easier over time. We hope that all of you continue doing, being, and thinking in wise ways on your way to making a life worth living. Nate, thanks for today. I appreciated this conversation.
Oh, thank you so much. It was a pleasure to be here.
Thanks for listening. Doing Being Thinking is an educational podcast about dialectical behavior therapy and is not intended as a substitute for therapy. This is a podcast outreach of Adolescent and Family Behavioral Health Services, offering both in-person and telehealth therapy to children, teens, and adults throughout Michigan. If you are a Michigan resident and want to get started with therapy, including DBT, children's DBT, or other evidence-based therapies, please contact us at 616-719-0194 or find us on the web at www.adolescentfamilybhs.com.